Hello everyone, this presentation is about psychotherapy. Specifically, it covers the misconceptions of psychotherapy, what psychotherapy is, and it also discusses some of the mental health disparities that exist within the United States. This presentation is intended for African Americans. However, if you do not identify as that, I would encourage you to still continue watching and still find out some information about psychotherapy. Who am I? Well, I'm just a poor college student in the clinical psychology doctoral program at East Tennessee State University. I wanted to provide this presentation after a racist event that occurred on our campus back in September. A troubled youth decided to show up to a peaceful Black Lives Matter demonstration wearing a gorilla mask, holding a Confederate sack filled with bananas and nooses. At the events that followed this, all of the students, and especially the African American students, were obviously frustrated, but they had difficult times really identifying the areas that they could go or the locations they could go to seek psychological treatment or services. That was really profound for me because on our campus we have not one, not two, not three, not four, but 5 different locations that you could attend for psychotherapy or any type of counseling like service. That was not only shocking but disheartening to me to hear so many people in pain and not knowing where to go. And being a person who wants to provide mental health treatment to communities of people like me, it really was eye-opening. But it makes sense because we don't talk about it much in our community, and hopefully through talks and presentations and whatever it takes, we can start discussing these matters more. When we look at the research examining the racial differences among mental health, it really is ambiguous. If we look at the chart on the left, it's from a National Alliance on Mental Health Illness report that examined data from the Epidemiological Catchment Area Study and the National Comorbidity Survey of Mental Health, and found that the following rates of major depressive disorder among blacks and whites. Specifically, when we look at the prevalence rate over the 12-month period, we find that in this case, they found lower rates of major depression among blacks compared to whites. Same thing with the lifetime rates as well. Now, when we go over to the chart on the right, this is from the Center for Disease Control and Prevention's National Health and Nutrition Examination Survey. It documents the percentage of persons aged 12 and up by depressive symptom severity and race in the United States. On this survey, they found that non-Hispanic whites as having significantly lower rates of depressive symptoms regardless of severity. So there really is this kind of ambiguity among this literature. Taken all together, we really don't know the exact rates of mental illness among African Americans. In some settings, in some cases, they were higher, sometimes they were lower. But they also seem to be around the same level compared to other racial groups. So that's not where the disparity is. The disparity actually comes up when we look at the mental health service use or the access to care or utilization among African Americans compared to other groups. In this survey conducted by the Substance Abuse and Mental Health Service Administration from 2008 to 2012, it shows that white individuals accessed care 16.6% of the time, while African Americans accessed care 6.5% of the time. So there are obviously some factors that influence the accessing mental health services. And some of those might be at a policy level, including legislation that promotes discrimination from the provider towards the client, such as that we have here in the state of Tennessee. Legislation that also limits access to mental health services could also be a factor influencing that disparity. There also may be community level factors like faith-based beliefs. Stigma towards mental health treatment may be another one. Family beliefs, distrust in the healthcare system, cultural views such as black people don't go to therapy, which is one I hear a lot. a shortage of healthcare providers, and there's also this fear of being overdiagnosed or misdiagnosed with a serious mental disorder. There are also interpersonal level factors that contribute to this disparity in healthcare service use. And that might be cultural differences between the client and provider. There are not a lot of African American or minority providers out there to provide care to other African Americans or other minorities. And lastly, individual level factors such as personal beliefs about therapy, the person's willingness to seek help if they need it. Poverty may also limit access to psychotherapy. There is also a lack of knowledge about what psychotherapy is or how located may also be factors that influence the disparity in mental health service use. So now we're going to move on to some of the misconceptions about psychotherapy before we talk about what psychotherapy is. So some of the common misconceptions that we hear about therapy are only people who are crazy go to it. Well, this is false. People seek therapy for a lot of different reasons, including substance abuse, life transitions, or even adjusting to a chronic illness. And plus, there are no diagnostic labels of crazy. Another one is talking to family members or friends is just as effective. That is true, as having a good support system is beneficial. However, going to someone who is unbiased, keeps everything confidential, and is trained in how to best assist you is also beneficial. You can do it on your own. This is also true. Some mental health conditions go away without any treatment of any sort. However, that is sometimes in a minority of cases and may take months in order to do that. So why wait months when you can go see someone that can help you start that process to remedy your pain or whatever it is that you're going through? Another one, why pay to have someone listen to you complain? That is false. Therapy is a goal-focused, collaborative process where you gain skills and insight in order to achieve goals you set and hopefully reduce the problem or eradicate the problem that brought you to therapy initially. Therapists blame your parents for your childhood. Therapy may explore aspects of your past if they are relevant and help explain how your current problem is being maintained. And lastly, one of the last misconceptions are you need to stay in psychotherapy for the rest of your life. And that's false. You do not need to stay in therapy forever. Most interventions for common diagnoses like anxiety or depression often range between 8 to 16 sessions. Yet everyone moves at a different pace in treatment, and some more serious mental health conditions require longer and more intensive treatment. So what is psychotherapy? According to the American Psychological Association, psychotherapy is the informed and intentional application of clinical methods and interpersonal stances derived from established psychological principles for the purpose of assisting people to modify their behaviors, cognitions, emotions, and/or other personal characteristics in the directions that the participants deem desirable. That's a lot of words just to say that therapy is an evidence-based approach to facilitate change in someone's behaviors, thoughts, or feelings, or even other traits to help them achieve their desired outcomes. Therapy can be in an individual or group format, it can range in duration, frequency, and it can even look different between providers. So now that we talked about what psychotherapy is and what it is not, and you're interested in possibly locating mental health services, you can do so by visiting any of these following sites. All of them use your zip code to find mental health providers, therapists, or psychologists that are near you. You can also visit your primary care provider, as a lot of primary care providers are starting to integrate mental health providers into their setting. However, if yours does not have a mental health provider integrated into their setting, you could also ask them about referrals. So we talked about a lot within this past 10 minutes, but hopefully this is beneficial to you. And if you have any questions, comments, or concerns, feel free to comment in the box below. Thank you and have a great day.